Cartilage defects of the knee joint can be caused by trauma on the one hand side, but more likely by degenerative changes due to joint instability or, for instance, malalignment of the lower limb. There are several studies available that show the importance of cartilage defects in terms of reduction of quality of life on the one hand side, reduction of joint function, and there's a significant pain at exposure which can be observed by patients suffering from cartilage defects of the knee joint. For the treatment of cartilage defects of the knee joint, we have actually bone marrow stimulation techniques and transplantation techniques. Autologous chondrocyte implantation belongs to the transplantation techniques, and there's worldwide consensus that for smaller defects, bone marrow stimulation techniques such as arthroscopic microfracturing might be appropriate, but for larger defects, cell therapeutical approaches should be preferred. Spherox, as a product for autologous chondrocytes, is one of these. Generally speaking, the indication for autologous chondrocyte implantation is given in patients suffering from symptomatic full-thickness cartilage defects, graded 3 or 4, according to the ICRS classification. The approval by the European Commission upon evaluation by the European Medicine Agency specifically for the Spherox product has been given for the repair of cartilage defects in adult patients and defects not exceeding a size of 10 square centimeters located on the femoral condyles and on the patella. The first step of every ACI is actually the harvesting of the cartilage for the in vitro expansion process. This is usually done via an arthroscopy of the knee joint, which is also important for checking the indication for the ACI. Once this is done, the arthroscopy proceeds with the cell harvesting, which is done with a standardized osteochondral 4 mm diameter cylinder from the edge of the fossa intercondylars, or alternatively with a curette or sharp spoon from the upper parts of the trochlear groove. This tissue, combined with 250 milliliters autologous blood, is transferred to the biopsy kit and sent to the company Codon. Following the cartilage biopsy, the next step in ACI is actually the in vitro expansion process, which is performed in the laboratories from the company Codon and takes approximately 6 weeks. Approximately 2 weeks after taking the biopsy, the date of transplantation is confirmed by the company Codon, and the cartilage product Spherox is delivered at the time of this transplantation date. Following the in vitro expansion process, the next step of ACI is the transplantation. Independent of the detailed defect location, it can be performed full arthroscopically or via mini-arthrotomy. Debridement of the cartilage defect is the first step of the transplantation procedure. Using a curette or sharp spoon, the damaged tissue is removed completely, ending up in surrounding healthy cartilage. It's also important to remove all damaged cartilage from the subchondral bone and also avoid bleeding, on the other hand, out of the subchondral bone. After drying of the defect, the spheroids are applied onto the subchondral bone using between 10 and 70 spheroids per square centimeter. After that, over a period of 20 minutes, the adherence of the spheroids is weighted. The spheroids have the characteristic to stick on the subchondral bone alone, so no additional fixation is needed. Following the transplantation, actually the rehabilitation of the individual patient starts. This includes, in general, 6 weeks of partial weight bearing, independence of the defect location, limitation of the flexion of the knee joint is recommended, such as for patellofemoral defects. Continuous passive motion is a principle which we really appreciate and consider important, not only for cartilage regeneration, but also for joint homeostasis in general. Afterwards, the patient is stepwise reintegrated in his daily life. Nevertheless, full contact sport is not recommended within the first year following the ACI procedure.